Goes on longer, experts learn more about the long-term impacts of the virus. So today we're focusing in on the heart. 7 News medical expert Dr. Cedric McFadden is joining us socially distanced here in the studio. So Dr. C, good to have you with us today. Let's talk about what we know about the impact of COVID-19 on the heart.
So when we initially started this conversation several months ago, we talked about the lungs and how the lungs were a site of inflammation with COVID-19. Well, we've also known that people with heart disease may be at increased risk for complications or severe disease. We now know with research that's published from the JAMA journal, it's a peer-reviewed journal with cardiology involved, that we see that the heart may be a site of long-lasting impacts from COVID-19. They looked at 100 patients with COVID-19. Most were young, most were in their 40s and 50s, and they recovered from the virus. They did an MRI 2 to 3 months after the fact and saw that 78% of those patients had long-lasting abnormalities of the heart after their infection.
That's really interesting. What about what the damage looks like? I mean, what do we see in terms of the damage? How does that damage actually happen?
When they did the MRIs, they saw that these patients had inflammation of the heart. This inflammation of the heart was present regardless of if they spent time in the hospital or if they recovered at home. In fact, only 1 out of 3 of those patients had actually spent time in the hospital related to their COVID-19 infection. It also was present regardless of how long the period had been from their recovery, and it also was there regardless of if they had pre-existing heart disease. Again, most of these people were healthy at the onset of their illness.
When it comes to damage in the heart, are there symptoms that people experience long-term that potentially could trigger or reveal heart disease?
So there may be some symptoms. Inflammation, if you think of inflammation as the prerequisite or it's the precursor of having heart failure or having further heart disease. So if you have a heart that's been inflamed, which way they've seen on the MRI, you give it some time, you can see residual disease that can then lead to other forms of heart disease. So there may be symptoms such as shortness of breath. Perhaps you could walk across the street or take a flight of stairs without feeling short of breath or heart palpitations. That could be a sign that you need to be paying attention for in the long term.
When it comes to this, it's so new, right? I mean, we are just months into dealing with COVID, people surviving COVID. They're so grateful to make it through, and then they're hearing about this stuff. How long will it be till we really know the long-term impacts? We got the few studies that are giving us some insight, but when will we know what people truly face?
So over time, we'll know more. It's too early to know whether or not these signs are present in the temporary period or whether it's permanent damage. But it does create a conversation starter between anybody that's had COVID-19 and their doctors to stay on top of it, pay attention to the signs, pay attention to shortness of breath, chest pain. It could be something that you need to have some medication for. You may need to have further x-rays or studies that could hopefully prevent any longer lasting damage to the heart in your life.
And are those the signs pretty much that people should look for if they've survived COVID and are concerned about any heart impacts, the shortness of breath, things like that?
And chest pain. And we've talked about this before that, in certain patients, such as women, you may have atypical signs of heart disease. It may be more nausea, it may be fatigue. Those are signs that you also need to be. But the first thing you really need to do is start the conversation with your doctor, especially if you've been diagnosed with COVID-19 for the long term.
Dr. C, we thank you. You're watching Carolina's Family at 4. Stay with us. We're coming right back.